Hello, my name is Nabja Morajon, and the topic of today is clinical significance of symptoms in smokers with preserved pulmonary function. Definition: COPD or chronic obstructive pulmonary disease is a progressive disease that makes it hard to breathe. Progressive means the disease gets worse over time. COPD can cause coughing that produces large amounts of mucus, wheezing, shortness of breath, chest tightness, and other symptoms.
Understanding chronic obstructive pulmonary disease, COPD. Chronic obstructive pulmonary disease, or COPD, is a lung disease that makes it difficult to breathe. COPD is a long-term disease that often gets worse over time and is characterized by inflammation and severe limitation of airflow in and out of the lungs. COPD is an umbrella term used to describe a group of breathing conditions, the most common being chronic bronchitis and emphysema. Many people living with COPD may have both emphysema and chronic bronchitis. A few people have both asthma and COPD. Cigarette smoking is the leading cause of COPD. Long-term exposure to secondhand smoke or irritants such as air pollution, dust or workplace fumes, and biomass exposure such as wood smoke can also contribute to COPD. An uncommon genetic disorder called alpha-1 antitrypsin deficiency is sometimes associated with COPD. Although respiratory infections such as influenza and pneumonia do not cause COPD, they can make people with COPD very sick. Therefore, it is very important to keep these vaccinations up to date. At first, COPD may cause no symptoms or only mild symptoms. As the disease progresses, common symptoms include shortness of breath, wheezing, and chest tightness, especially with exercise, and an ongoing cough, often with a lot of mucus. As COPD symptoms worsen, breathing requires much more energy, and it can get harder to exercise or do routine activities like getting dressed or climbing stairs. This may lead to fatigue, weight loss, and muscle loss. People with COPD can experience a variety of symptoms. Different stages of COPD range from mild to moderate to severe.
Cigarette smoking is the leading cause of COPD. Most people who have COPD smoke or used to smoke. Long-term exposure to other lung irritants such as air pollution, chemical fumes, or dust also may contribute to COPD.
Educating patients about asthma and COPD. You've been diagnosed with lung disease. You're not alone. Today there are millions of people just like you learning to control the symptoms of asthma and COPD. More is known about these diseases than ever before. Therefore, more can be done to help you manage your symptoms and live a fuller life. Asthma affects more than 150 million people in the world, and COPD, which your doctor may refer to as chronic obstructive pulmonary disease, is the fourth most common serious illness to affect people living in the United States. Take a moment to learn about asthma and COPD and what you and your doctor can do to control them. Great strides have been made in understanding asthma. The medical field now agrees that asthma is a disorder characterized by twitchy airways, known as hyperreactivity, and inflammation in the lungs. There are different types of drugs used to treat these two characteristics of the disease. By focusing on the underlying inflammation, you can better control the symptoms to reduce the occurrence of asthma attacks. Inflammation is a response that normally occurs when your body needs to fight a disease or a disturbance to its natural balance. Asthma, allergies, cold, stress, or exercise can all cause inflammation. Inflammation can also be the result when you breathe in cigarette smoke or have a viral infection. You probably know the feeling of an asthma attack, the tightness in the chest, the feeling that you can't breathe, or perhaps even wheeze when you breathe. But do you know what's actually happening inside your lungs? In people with asthma, the inflammatory response is exaggerated and many different kinds of cells are involved. These cells go through a complex set of activities to release chemicals. The chemicals are what cause the symptoms of an asthma attack. If this happens on a regular basis, your lungs may be damaged.
Applications in medicine. Signs and symptoms of COPD. Ongoing cough, increased mucus, shortness of breath, wheezing, fatigue, frequent flare-ups.
How to detox smoker's lungs. Healthy lungs are pink. A smoker's lung is black. By now, most of us know what health problems arise from smoking, with lung cancer and heart disease being the most life-threatening. Despite graphic warnings, however, many continue to smoke, and many more start smoking. The good news, you can quit and regain healthy lungs if you are willing to stay the course. The sobering truth is that, once lung tissues are damaged, totally reversing it is highly improbable. However, even with grim prognosis, there is still hope. In the past, it was believed that black lungs have no chance of rejuvenating, but medicine has grown in leaps and bounds since. Modern discoveries point to remedies, both herbal and traditional, that could stave off total lung damage due to cigarette smoke. Although the process could take years, you can take immediate steps to achieve immediate relief. Here's how to detox smokers' lungs after you quit smoking. 1. Eat raw honey every day. Anecdotal evidence abounds that a teaspoon of raw honey a day keeps lung cancer away. Even with years of smoking, people who consume raw honey daily report that they start coughing up tar after only a week of honey therapy. They also enjoy increased vigor that leads to a more physically active life. Honey brims with antibacterial and antiseptic properties, so starting your post-smoking rehabilitation program with it yields encouraging results. Honey is also rich in minerals that promote tissue repair. 2. Avoid mucus-forming foods. Processed meat, dried and frozen convenience foods, fast foods, and dairy and non-dairy confections trigger mucus production. Even starchy vegetables and fruits, along with fatty oils from avocado, corn, and canola, stimulate the mild production of mucus. So eliminate the former types in your diet and consume the latter in small amounts.
Treatments. Quiet smoking and avoid lung irritants. Medicine. Bronchodilators relax the muscles around your airways. These help open your airways and makes breathing easier. Steroids help reduce airway inflammation, pulmonary rehabilitation, and oxygen therapy. issue applied in Ecuador. Most of the time, COPD is diagnosed in middle-aged or older adults. The disease isn't passed from person to person. You can catch it from one else. COPD has no cure yet, and doctors don't know how to reverse the damage to the airways and lungs. However, treatments and lifestyle changes can help you feel better, stay more active, and slow the progress of the disease.
Hello and welcome to this week's episode of Medspiration. Did you watch what I just watched? Where that young lady seemed to age about 50 years in a time lapse of about 30 seconds? By now, most of us understand the health problems that can arise from smoking cigarettes. Healthy lungs are pink. Smokers' lungs are black. Every time you smoke a cigarette, you're inhaling ammonia, the bleach and toilet cleaner, acetone, the chemical and nail polish remover, benzene, found in paint stripper, and hydrogen cyanide, used in rat poison. Blood that's thick and dirty with toxins circulates through your body in seconds, increasing your chances of a heart attack, stroke, and lung cancer. Despite graphic warnings, many continue to smoke, and many begin to start smoking. But we do have some Medspiration for you. You can quit and regain healthy lungs if you're willing to stay the course. The sobering truth is that we can reverse lung tissue damage and decrease our chances of contracting lung cancer if we quit smoking cigarettes entirely. Modern discoveries point to remedies, both herbal and traditional, that could help stave off total lung damage due to cigarette smoke and rejuvenate the lungs over the course of many years. You can take immediate steps to achieve immediate relief right now. Number 1. Eat raw organic honey. Real raw honey that's not pasteurized and not heated comes straight from the beehive and is a potent superfood sweetener gathered by one of the most profound creatures on planet Earth, the honeybee. It brims with all natural antibacterial, antiviral, and antiseptic properties. The human use of honey as a natural medicine has been dated back as far as 8,000 years ago. In addition to the important role of honey in traditional medicine, the National Library of Medicine also accepts raw organic honey as an effective medicine for many kinds of disease, including gastrointestinal, cardiovascular, inflammatory, and neoplastic states. Even with years of smoking, people who consume raw honey daily report that they start coughing up tar after only a week of honey therapy.
Thank you.